In healthcare, most academicians think that it's translating the latest in science to medicine. That actually takes a long, long time, and it takes years for a new theory and a new cell and a new gene that's discovered to actually become human healthcare. What the trends will be next is really translating consumer electronics back into medicine. And that's because whenever it goes to the consumer electronics, it's really usually something very good. And how good is a drone, and how good is LED lighting, all of this. And usually it's really cheap if you make it in millions, okay? And if you already are producing it in some high-mind way. So, for example, one of the most terrible things I see every day is that we now do laparoscopic surgery or robotic surgery where we put little cameras and little tools into people and operate on them. But the lighting is still a xenon light in a box with a fiber optic cable that burns the patient if we put it right on their skin, that goes inside from one angle because 50 years ago that light and that cord was so expensive that we would never think of doing two of them in the same patient. And then the camera system is that it really is a chip way out here that detects it, and the whole system costs like $200,000, okay? And trying to transform it to LED lighting, to drone camera-based 3D streaming of data to your virtual reality goggles that the gamers already have on board, would not only make it better, but cheaper. And so all that's coming, and it will totally disrupt healthcare and all the companies. And some are preparing for it, and most are not, okay? And so it's totally fascinating to me where everybody's sitting. And the last thing is automation. It scares a lot of people in healthcare. So whenever I say I would like my operation to be 90% automated in the next 5 years, because I'd rather sit here with a cup of coffee, stay fresh for the hard parts, and which is what the air pilots do, right? If you thought that that pilot had his hand on the wheel all the way across country, he would never fly that plane, okay? and that's what should happen. But boy, every time I say it, the naysayers and the 19th century administrators say, you know, you can't quite do that.